This muscle makes up less than 1% of your back, but it controls 100% of your spinal stability. Deep inside your spine, wrapped around each vertebra, is a small muscle called the multifidus. It's barely bigger than your pinky finger, but this muscle is responsible for something critical, keeping each segment of your spine stable and aligned, especially when you move, bend, or stand. Think of it like the individual bolts that hold a bicycle frame together. If one bolt loosens, the whole frame wobbles and creaks under pressure. That's exactly what happens when this muscle stops working. And here's what nobody tells you. When you injure your back, or develop chronic spinal compression like stenosis, your brain flips a protective switch. It shuts the multifidus down to prevent movement in that area. It's an automatic survival response. The problem? Once that muscle shuts down, it doesn't turn back on by itself. The muscle fibers weaken, fat replaces the tissue, and your spine becomes inherently unstable. So what happens next? Your surface muscles, the ones you can actually feel, start overcompensating. They clench up, trying to do the job the multifidus is supposed to do. That's where the tightness comes from. That's where the morning stiffness comes from. That constant feeling like your back is locked up and braced. And here's the part that explains why nothing has worked. Stretching, massage, injections, even most physical therapy, all of it targets those surface muscles. It might feel good temporarily. It might release some tension for a few hours, but it is not reactivating the multifidus. It's not turning your spine's control system back on. That's why the pain always comes back. You've been treating the symptom while the root cause stays completely dormant. This is called core muscle lockout. And it affects 90% of patients with chronic spinal pain. Whether you have stenosis, whether you've had L4-L5 fusion, whether you've had laminectomy, the surgery addresses the bones and the discs. It cannot reconnect a muscle your nervous system has shut down. That's why 28% of fusion patients are still in significant pain, even when imaging confirms the surgery was successful. The hardware is perfect. The foundation it's sitting on is still offline. Now, spinal specialists have known about multifidus dysfunction for years. In clinical settings, they use electrical stimulation to force these deep stabilizer muscles to contract and reactivate. The problem is that standard TENS units, the ones you can buy anywhere, don't penetrate deep enough. They work at 5 to 8 millimeters. Surface tissue only. They cannot reach the multifidus. That's where NMES changes everything. NMES, neuromuscular electrical stimulation, is specifically designed to target deep stabilizer muscles, not surface tissue. It sends precise electrical pulses 30 to 50 millimeters deep into your spine, directly forcing the multifidus to contract. It's not masking pain. It's sending a reactivation signal to a muscle that your nervous system disconnected. That's what Relivex does. 15 minutes a day at home. Here's what happens when the multifidus starts firing again. First, those overworked surface muscles can finally relax. That's where you feel the tension release. Second, your spine has its internal support back. That's the sense of stability patients describe after the first few weeks. Not pain-free immediately, supported, like something is holding again from the inside. Over the full treatment protocol, you're not just temporarily activating the muscle, you're rebuilding its strength, restoring the neuromuscular control your spine lost, sometimes